Managing your feelings whilst waiting for your urgent appointment. So you've been referred for an urgent appointment. It is normal to feel many different emotions when you are waiting for an urgent appointment, such as worry, anxiety, frustration, anger, and low mood. You may feel okay one minute, and the next can be overwhelmed by your feelings. You may notice that your feelings change over time, from when you first see your GP to waiting for your appointment and seeing your specialist team. It can be helpful to remind yourself of the things that you usually do to manage your feelings. You may find it helpful to talk with family or friends or ring a support line. You may find it helpful to try to distract yourself from your feelings by doing things that you usually enjoy. Being physically active can be especially useful. If you feel worried about your health, then doing something positive to look after your body can be beneficial whilst waiting for your appointment. Watch our other videos for more ideas on how to look after yourself during this time. Sometimes our feelings can become overwhelming and tricky to manage with our usual ways of coping. When this happens, you could try to use some new skills. Let's take a look at anxiety and breathing. When our mind is worried, anxious, or even angry about something, our body tries to help by getting us ready to face the challenge. It does this using the sympathetic nervous system, which is responsible for the physical symptoms that we experience, like a racing heart, fast breathing, and getting hot and sweaty. This is to keep us safe, but it can be unhelpful if we are not in danger. Breathing slowly and deeply, in through the nose and out through the mouth, can help quiet down the sympathetic nervous system and that fight or flight, freeze response, and lets our mind know that we are safe. A simple breathing exercise to try is rectangular breathing. Imagine a rectangular box, or you can use a window, door, table, or anything that you can see that's a rectangular shape. Imagine tracing a line around the edge of that rectangle. As you go along a short side of the rectangle, breathe in. And as you go along the long side of the rectangle, breathe out. Continue this until you feel yourself begin to calm. It is a good idea to practice this when you are not feeling anxious. This way, it will be easier to use if you are feeling stressed or overwhelmed. Grounding. Another way to help manage overwhelming feelings is to use grounding techniques. Grounding just means reminding your mind that you are in a safe place by noticing the things around you. One way of doing this is to try the 5-4-3-2-1 technique. Look around you and notice 5 things that you can see. Listen for 4 things that you can hear. Focus on 3 things that you can feel. Notice 2 things that you can smell. And focus on 1 thing that you can taste. As with the breathing exercise, it can be helpful to practice this when you are not feeling overwhelmed. As you get closer to your appointment, you may notice that your mind gets busier and you experience more feelings. It can be useful to prepare for your appointment. You could watch our video on your urgent suspected cancer referral so that you know what to expect. Write down any questions that you might want to ask during the appointment. It is easy to forget things when you are feeling anxious. Think about who you may want to take with you for support. They can write notes to help you remember what was said during the appointment. Letting your employer know what is going on can be helpful, particularly if you will need to miss work for a short notice appointment. You may feel so overwhelmed by your feelings that you are tempted to not go to your appointment. Please speak to your GP and let them know of your concerns. They will be able to help. Remember that it is normal to feel lots of different emotions during this time. There are links to other sources of help attached to this video. Thank you for watching. For further information on how to prepare for your upcoming appointment, please watch our other videos. Please give this video a like if you have found it helpful.